Hello, everybody. We're going to get started with this program. So I'd like grab some food and sit close. I don't want anybody sitting in the back row. There's no need for that. It's much more enjoyable to be down front. You'd never sit in the back row if you were at a theater. So sit down here. Enjoy it. Come on up closer. We have some good videos to show by the group that we had here before. So, thank you very much for coming today. Nice of you to kind of give up part of your Sunday afternoon, but of course this is a bonus Sunday afternoon because you got an extra hour today. So, we appreciate you using that hour here with us. It's nice to see you all here. Anyway, this is kind of a new venue. We did this last year at the same place, worked out pretty well, and it's pretty convenient. So this is kind of in the second year that we have used this facility, and look forward to kind of a good time. We are going to go through several things here. Let's get these slides going since I'm going to use those to keep me online here. This is our 5th annual Canes or Cons thing, which the idea started because the summer students that spend a few weeks, actually several weeks. How many? 5 weeks? Usually 5 weeks with us, and that one of their little projects that they have to do is to come up with a little research project that they make a little video of, and these are always very interesting, and we're going to be showing these later on, and you're going to get a chance to vote on them as to which one you think is the best. Next slide, please. Where's my next slide? Right up. Let's go with another slide. So just a little brief review. Bill Jackson, who the Jackson Orthopedic Foundation is obviously named after, was somebody that I learned orthopedics from back at Summit Hospital when I was a resident. And he basically was very interested in arthritis with another fella, and he got into this thing with total joints, which now is probably one of the best operations it's done. And as a result, he had many grateful patients who wanted him to kind of pass his knowledge along to younger people and spread the word, so to speak. So they donated a fair amount of money over some years, and he started the Jackson Arthritis Foundation with another fellow that he was in practice with, Mac Reynolds, who unfortunately passed away some years ago. But that then became the Jackson Orthopedic Foundation, so it could kind of include things other than just arthritis. So it's kind of morphed into that kind of thing, and the current shakers and bakers in the organization, who you're going to hear from a little bit later, have kept it going. And it's been an interesting experience, and some of us kind of in the area have kind of helped out keeping it going. But let's have the next slide then, please. Now we have sponsors. One of the big sponsors is the Morgan Stanley people, and you'll see their name on one of the tables, or maybe actually multiple tables here. So next time you got $500,000 you want to invest with somebody, think of Morgan Stanley. That's what I want you to do. Next slide, please. The organization now is thanks to communications being able to be virtual as well as in person. We're kind of spread all over the world right now. We actually have Tim Hart, who is kind of one of our very valuable helpers, who lives in New Zealand. And now is Tim hearing us now?
He should be.
He should be, but we can't hear him.
No.
Okay. And it's probably the middle of the night anyway, so we wouldn't want to hear from him.
It's in the middle of his workday.
It's in the middle of his workday, yeah, right.
But he's dialing in at lunch, hopefully.
Justin Clark, who's been a very valuable person in the organization is in Germany, where he checks in with all of our meetings that we have, and we have meetings a few times a year, and he's always there, and I never quite know if it's a noon meeting to him. I kind of look to see if he's wearing his pajamas or what kind of dress he's in, since he's in Germany. But at any rate, that's kind of one of the beauties of what we have going for us this day and age. And there have been other people too. We have done a couple virtual gatherings like this during the height of the pandemic, and I must admit I was a little pessimistic that they were going to work, but they actually came off very well. I thought the way we had the chat rooms beforehand and the formal program afterward was very interesting and worked out quite well. Next slide, please. So this again is the history, refreshing just a little bit. Dr. Jackson was a good physician, but a greater person. I mean, I think he had a great rapport with his patients and with the community in general. And so it wasn't just a fluke that his name was started because of these grateful patients, and that it continued on even after he retired, and that people have wanted to kind of keep the flame going, so to speak. If you go down that, you'll see that there was another fellow who became very instrumental, Jerry Goldman, who was the medical director for some years, and he's now retired. And basically, I've kind of assumed that role, but my role is kind of just to keep things going, not anywhere near the way that he did and the early predecessors of this group. But there are now other aspects of the program that you're going to hear about a little bit that are really interesting, and I kind of help out teaching, giving a little talk in the summer when the students that are in college come, and also in the during the year they just had a nice program at this facility actually, and so there's kind of ongoing continuing education which keeps the program vital and interesting for participation. Next slide, please. This is just kind of the people that are involved in the organization. Kathy Matthews, who's not here today, but she is involved in the board of directors, I guess we call them, and other people, and that's Justin Clark down there below that you see. That's, I guess, presumably listening in Germany somewhere. Next slide, please. And then this program put on today takes a little bit of organizing, and I shouldn't say a little bit, a lot of organizing. Kathy works very hard at it and always pulls the rest of us in and keeps us on point. Tom Wagner, who's right behind you, is our AV man and kind of keeps the group together. And Tim Hart, and as I mentioned a minute ago, he's actually in New Zealand. We think he's listening, but we're not sure. Anyway, so that's the group that kind of keeps this thing going. Next slide. That's my AV guy I've been talking up. Now where is he?
That's the next slide.
Oh, was that? Oh, I'm sorry, I turned away. So Kathy mentioned, and I want to mention to you too, this is, cleverly disguised as a fundraiser to a certain extent. And so if you'd like to get involved and do that, be sure and bid on some of the things in the silent auction over there. There's some good Oregon wine that I was looking at. Where's the little wine? Where's our winemaker? Oh, he's not even. He's back there. There he is. So anyway, we have some good Willamette Valley wines. We have lots of good things there. So be sure and walk by and put in something on the silent auction if you haven't done it. Is it now working okay?
It's working better.
Is it? Okay.
Are you okay with it?
Yeah, good. So be sure and support the group from that perspective if you would. They're good items to take home with you. I think we're ready to talk. Go ahead about some of these new programs. So we've talked about the silent auction. The next thing, Maggie Macy, who I hadn't seen for many years, is going to talk to us. It's interesting when you do something like this. I'm around residents a lot training, and it's always fun when I see a resident that I haven't seen for 10 years and these are orthopedic residents now, and find out what they've done and what life is holding for them. And you kind of like to think, well, maybe I or we had a little something to do with them at that point in their life. But Maggie has had an interesting life and has now gone on to become a nurse, and she's going to get up here and tell us about her experiences at the Jackson Orthopedic Foundation and what she's been doing since. Come on up and use the microphone.
He's so tall. All right. How's it going, everyone? Can you guys hear me? Awesome. All right. Thanks so much for just kind of letting me, share a few words about my experience with Jackson Orthopedic. It actually goes way back. So when I was very, very young, my father was and still is the head football coach for Camp Lindo High School. And when he was a very young coach, he had the honor of having Dr. Mac Reynolds as his team football coach, or not team football coach, team doctor. Thank you. So, many of his actually football players have come on to become doctors, orthopedic surgeons even, and many of his players went through the same internship program that I had the honor of going through. So I had graduated Campo about 2012, so 2013 or so. I was lucky enough to be introduced to Kathy, and I was lucky enough to be an intern, and I got to shadow many of the people actually in this room today. But honestly, when you're 19 and you don't really know much, it's awesome just to have an experience like this internship program where you just kind of get to see other practitioners, you get to see patients, and you kind of just get some baseline anatomy, physiology, orthopedics, and all that. So that was honestly probably the best thing about the program, was just giving you some sort of baseline in the healthcare, in the healthcare, just because it's so, such a hard field to get into when you're young. So then, love that I got to take that into my nursing program. During the summers of my nursing program, I got to come back, be the intern program coordinator, and help more interns kind of get the same experience that I got. And then, let's see, I'm trying to think. I fast forward a little bit, I graduate nursing school, and I become an orthopedic nurse. So again, getting to use that awesome orthopedic baseline that JOF gave me. And then got reunited again with Jackson Orthopedic just this last year. Finally moved back to the Bay Area after being an ortho nurse for about 5 years. And we were really lucky to have just an incredible group of interns this summer. We have one of them here with us. Say hi, Sarah. So yeah, we had an awesome group, and honestly, this program just does so much for young people. And, it's done so much for me in my life, and I just thank all of you guys for making it possible. So thank you so much. Of course.
Yeah, it's always interesting to hear what people do when you've seen them at a time in their life when they're kind of all options are open and so on. Good job. Good presentation. And you're now a pharmaceutical, yes, right. So that's neat. And you've had a handful of jobs, it sounds like. Right. Neat. So the real nuts and bolts of this organization is the immersion program that takes place in the summer, as well as the instructional programs that take place during the year, are run by Kathy and AJ. And I think, who's going to speak first at this point in time? All right, they're going to come up together, and don't let AJ scare you with her outfit.
Yeah, well, it's our job to tell you about the three main programs that the Jackson Orthopedic Foundation runs. And we're going to start just with the three flagship programs that have been around the longest, but we'll also bring you up to the current era because we've morphed, as I love that word, we've morphed into some new programs. We've tried some new things this year, and partly due to the pandemic, we had to rearrange the way we taught. But we got through all that. So the first program I want to tell you about, and then AJ will talk about the second, and we'll sort of merge the third one. The Healthcare Immersion Program, and that's the program, we now call it Healthcare Immersion, or HIP. AJ coined this term, and we like it because it's hip, right? It's hip, but it's also hips that we deal with an awful lot. So the Healthcare Immersion Program, formerly known as the Summer Intern Program, is the program Maggie just told you all about. It's been in existence for the entire 25 years of the organization. Actually, next year is our 25th anniversary, but 24 years. But it even preceded that because Dr. Mac Reynolds and Dr. Bill Jackson ran sort of an unofficial internship program and brought students into their clinics. And I suspect a lot of you who work in medical care have done that throughout your careers. So the program itself, traditionally, go ahead, one more slide, Tom, if you will, please. It provides college students with a pretty unique immersion experience. They are assigned to preceptors. A couple of our preceptors are here today too, and they follow them, they shadow them. It's not a hands-on experience. It's simply watching and learning. They have to have, the criteria for entering the program is 1 year of college under their belt and an interest in medicine. So several of you went through the program. Some of you have children and nieces who went through the program. And we're excited to say in these 24 years, we admit an average of 6 to 8 students in a summer, sometimes only 4. This year we invited 7 because they all interviewed so well. But do the math, 24 years of that many students plus or minus. And we've managed to touch a lot of young people's lives and help them enter into healthcare. We also keep track of them. And we love to hear from our students who've gone on. One is sitting at this table here. And I'm proud to say, you know, my son Jacob not only was an intern, but he ran the program after Maggie ran the program. So you can see we're a little incestuous, but by the same token, we get the best teachers by watching our students learn to be medical healthcare professionals. So the next slide, please. This was our 2022 group. Sarah's here with us tonight. A couple of the students who are on this slide are listening through YouTube. And we drew from a pretty wide geographic area this year. Sometimes we draw from far and wide, sometimes they're pretty local. One of our students this year was from Canada, and I think that's the first time we've had a Canadian in the program. Yeah, we're getting international, like our board of directors. So Manav was our Canadian gentleman. But Nia, Sarah, Trang, Sophia, Andre, Manav, and Vivian, and you'll see their final projects, their public service videos in just a few minutes, and you're going to vote on them. So next slide, please, Tom. So the program involves getting together once a week for a clinical conference. And in this slide, we usually teach them musculoskeletal skills or have a skills program that they get to learn new things that they'll use in medicine. We blend that with the clinical conferences, which is, they're just 2 hours once a week, where they present their clinical reflections to each other and to us, and they do some research, and they present papers on what they've researched. And we ask them to draw from their clinical shadowing experience. So if they watch Dr. Schwartz do a carpal tunnel procedure, they may be inclined to research that and come tell us about it. And one of our students chose to make a video about that. And the next slide, please. Skills workshops. As I said, we try to focus on musculoskeletal, but sometimes we'll just teach them vital signs. And this one, excuse me, is splinting and casting. And probably one of the highlights of the program, they all want to watch surgery. And of course, if we can provide that opportunity, it's gotten a little harder because of rules and regulations and of course HIPAA. But a couple of our physicians who we've worked closely with through the years are always willing to have the students come and observe surgeries. So this was a couple of years ago, and that's our Dr. Schwartz over there, and he's at the middle table, just so you know. Next slide, please. AJ is going to tell you about another one of our flagship programs.
Right, but before I do that, of course, I have to add a little bit to what Kathy said about the HIP program. And it just, in case it isn't clear, the students spend time not just with orthopedists and surgeons, but they get to spend time with physical therapists, with nurse practitioners, with nurses. We try to give them a wide variety of experiences, and many of the students have told us that they, with PAs, I think as well, many of the students have told us that they knew they wanted a healthcare career. I remember one of the very earliest students who spent time with me who thought she wanted to be an orthopedic surgeon, and by the time she finished with her visit realized she did not want the level of commitment it would take to be an orthopedic surgeon, but she continued on to be, I think, a nurse practitioner. So she just realized too many years of study and it would eat up my life. It's all I would be doing was being a doctor, and I want a more balanced life. So I see that as a success in that a young person figured that out before they put themselves in the system through medical school, right? So that's a big piece of, I think, what we're helping young people with is clarifying what their goals are. Now, the other group that we work with is the old people. Not really old, but people who have already come into the system as primary care providers. And this happened because Kathy and I, although we both worked as orthopedic nurse practitioners, we learned by the graciousness of our mentors, many of them at Webster Orthopedics, and then me with another physician who saw the opportunity to meld the orthopedic surgeon skills with the nursing skills. And that all goes back to, if you see over on the table there, Dolores Beanland, who was a nurse practitioner before there were nurse practitioners. Dr. Jackson recognized that partnership between nurses and surgeons could be really valuable, with the nurses filling in sort of the whole person stuff and the surgeons filling in the highly technical stuff. The team together is terrific. So Kathy and I kind of figured, and we went to all kinds of orthopedic surgeon workshops, and on every airplane trip back we would say, somebody needs to put this together for nurses. Somebody, so we're not always going to medical conferences, somebody needs to do this. And then it dawned on us that not only did somebody need to do this for nurses and nurse practitioners, but orthopedic primary care came out of the realization that once we started trying to put that education program together, we realized that physicians were publishing articles saying that primary care physicians didn't have adequate musculoskeletal content in their medical programs. And this was, what were we talking, 2010 or so. And so we were kind of looking at their pathway, and they were eventually able to get, I think as of 2020, every medical school in the United States now has a dedicated musculoskeletal component to it that's like 6 or 8 weeks or something. I'm looking at Jacob, but he's in a different realm, so his school has always been there with it, yeah. But what we realized is that most primary care providers, and particularly nurse practitioners, we both went to nurse practitioner school. We got tiny amounts of musculoskeletal content, but as we learned through the literature, our primary care physician folks until 2020 were also getting limited amounts of musculoskeletal info. Thus was born the OPC program, which is Orthopedics for Primary Care Providers. And I have always felt strongly that this goes along with Dr. Jackson's original mission, which was about, if we think back to the Jackson or Arthritis Foundation Center. He actually articulated to me one time that he was interested in keeping people from having to have those joint replacements and what leads up to that. And so he was kind of interested in making this organization about non-operative care. And so we've kind of moved into that realm, and we have a whole curriculum now from soup to nuts for the primary care provider. We have mostly been spending our time with nurse practitioners because we haven't yet found a PA program or a PA to work with us that can help us get into accreditation for PAs. And then, of course, getting accredited by the medical provider units is another whole ball of wax. It's on the list. Anyhow, at least our whole program started out as once a year we would have 8 or 10 students come to the Jackson Orthopedic Foundation office 1 weekend a month for about 6 or 8 months, and we would walk them through 2 days worth of very intense training. When COVID hit, we couldn't have them in the same place, so luckily we had started to tape all of our presentations, and we were able to put the whole program online, and with Tim Hart and Tom Wagner's help, it has become a really nice seamless program. And so we're offering it as an either online, in person, a little bit of both. There's all kinds of options that people can have. Kathy and I present parts of that program every year at California Association of Nurse Practitioners Conference, and we are, I can go ahead and say this, we are currently talking to a college in Hawaii who became aware of our program and is wondering if we can run a program inside of their nurse practitioner program for their students. There are apparently some orthopedic practices in Hawaii who would like some trained nurse practitioners and some primary care practices as well. So it's kind of an interesting little world we're building with the orthopedic primary care program. Any of the physicians who are out there in retirement who would like to make presentations for us on your particular favorite topic, we would welcome your guest lectures anytime. Dr. Slayball joined us once this semester, and the students really enjoyed what he had to say. But again, our emphasis usually is on primary care, but it's very useful for primary care providers to know when a patient is getting prepared for an orthopedic surgery, what exactly is going to happen in that surgery. Because if you haven't really walked through that, you can't really explain it well to a patient. And a lot of what NPs do well is educating the patient and making sure everything goes smoothly. So is there anything else anybody have any questions about that, or can I tell you anything else, or have you had enough? Yeah, there you go, next slide.
And you can keep going a little bit.
Oh, okay.
Actually, let me do this one.
Okay, go ahead.
Yeah, let me just take over just for a second. The weekend workshops that AJ mentioned, we do them a little differently now, but this is a picture from a workshop where I'm looking for Trish. Where's Trish? She's in the back there. Trish was one of our good friends, a retired nurse who came, and we asked our friends to be models. And so we practice their physical assessment. So our students are practicing range of motion on Trish in one of our spine courses. And Dr. Slayball has actually taught every year, I think, since we've been doing orthopedic primary care. Go ahead and do the next slide for me, Tom. And testing nerve function, I just have to point out the lady with the beautiful gray hair happens to be Trish's cousin. And Bob and Susan are related to this person too. So we recruit, if any of you ever want to be a model for us, you won't have to do anything painful. It's really just basic musculoskeletal assessment. But we've picked up on some interesting things by having friends and sometimes family come in. Next slide, please. And we even had Tom, our IT guru, as a patient for us one year. And he's got quite a few musculoskeletal concerns. Anomaly? I was trying to be polite. Concerns. Next slide, please. So the other program that we've traditionally done pretty routinely is orthopedic injection workshops. And we were blessed, 3 or 4 years ago, with a lovely grant to buy these models that alarm when you hit the needle in the right place. And we've got a nice collection of them. They're stored in this closet here right now because we moved the workshops here this year. And the injection workshops have actually morphed into something that we now teach 4 times a year. We used to do this twice a year, so it's grown. As something, next slide please, Tom, called Orthopalooza. And we enjoy Orthopalooza. I'm going to let AJ tell you a little bit about this. Dr. Slayball taught, that's what he was referring to earlier. He came and taught one of our lectures for this course this year too.
So we do Orthopalooza 4 times a year, and it kind of coincides with the orthopedic primary care program. What we found from most of these providers is that what they're really least confident in is their actual physical exam skills, because they don't get enough time to practice them in school, and they usually know what they're doing, but they need to be validated. They need to try it with somebody looking over their shoulder. So on an Orthopalooza weekend, if we're doing knees, if there's 8 or 10, or we put them in pairs, maybe there'll be 15 or 16 in a group. We put them in pairs, and then we make them examine each other, and then they reverse roles, and then they move down the line, and they examine each other, and they reverse roles. So they get to repeat the physical examination process multiple times, which builds their confidence and their skills. They also get, some textbook knowledge too, but we really try to keep the weekends very focused on hands-on practice, because that's what we find most of the people who come really want to do. And by the time they leave at the end of the weekend, we get the feedback that they feel much more confident, and then we check in with them later, and we find that they are doing things, and they now understand why they're doing things. I'm sure our orthopedic surgeons remember the very first times you were taught how to do a knee exam or a shoulder exam, and you learned all the names of the tests, and you did them, and did you really know what you were looking for? Or were you just going through the motions of doing the test? Maybe you guys had a better grounding in that than we did, but I find many of the students they're checking off the boxes. I did this test, I did that test, but when you ask them what did it mean or what were you actually testing for, they have a difficult time telling you. By the time they're finished one of these focused weekends, they have a much better idea of what they're doing, and they know which test to do for which complaint and how to, sort of focus in. So that's, we have a lot of fun with those. The room that we're using now is upstairs. It's a lovely space to work in. The students are very comfortable. It's bright and shiny, and everybody can move around, and it's a lovely weekend. So if you know someone who is practicing in primary care who is not quite comfortable with their ortho exam skills, please let them know that this is a resource that is available to them. We love teaching. Oh, I should add, let me just add one more thing. It turns out my new job outside of my volunteer job for JOF is with Samuel Merritt University. And I'm a clinical instructor for nurse practitioners, and I'm sort of the school's, the program's local ortho person. So I get called in for all kinds of stuff, but it was kind of fun for me this summer because my job at Samuel Merritt involves teaching nurse practitioners at a clinic in East Oakland. And I got to have one of the JOF interns, or a bunch of the JOF interns came to the clinic at East Oakland this summer. So as Kathy said before, it's a little bit of overlapping circles and incestuous relationships, but that's what keeps this organization going. And we're sort of spreading out with some of our orthopedic primary care nurse practitioners now also work with the JOF hipsters. So it's kind of neat that way. So.
I was going to say AJ has a little professorial in her, but now you know she does. AJ's been with the Samuel Merritt faculty, I guess, and it's PA nurses, and what other things do they have there? They've got a variety of, yeah.
Podiatry school.
Yeah, there's podiatrist school, yeah, yes, right.
Yeah.
So anyway, it's a very busy, active place. So now we're going to get to the interesting part of the program, in my opinion. It's always interesting to see what young minds come up with when you give them kind of an open rein on what they can make of some particular entity. In this case, obviously, it's musculoskeletal diseases, if you will. And these are always kind of interesting to listen to. So what we do here is have you watch these videos, and then we do voting to find out which of the videos you people think are the most interesting. And some of you are physicians here, and so you'll look at it in one vein. Some of you are lay people, and you'll look at it in a different vein. But it gives you a chance to do it, and then we do a vote. We'll tabulate this, and we'll have a winner. But there are really no losers, because you can see the number of Oscars we have up here far exceeds the number of more than one winner. I think the winner, though, gets something, a gift card. And by the way, Kathy kind of leaked it to those of you who might want to volunteer or stay close to this organization. Sounds like she's getting a Waikiki connection going here. So I have decided personally to stay with this organization at least another year or two, based on what I've heard in the last minute and a half. So anyway, so we'll kind of get this rolling. Now, I know that there'll probably be some, this is a vote that you have to do at the end of this. So, and I know there's going to be some election deniers in this group. And so I don't want to hear any rebellions or anything against it. You know, save that for Tuesday night, okay? All right. So you ready with the first one?
Oh, those are past winners.
Oh, I'm sorry. These are past winners. No, I'm not sure if they've been denied or not, but they were winners. We kind of went beyond. I think we're ahead of Donald Trump and company. Anyway, this first, the winner last year was Nicole Marquez, and she did an interesting presentation on rheumatoid arthritis. And there's one of the subjects here is on rheumatoid arthritis too. This is the group of people, of students that did their projects this year. I didn't get a chance to see them in person this year. The one talk I gave was done virtually. So it's kind of a first chance for me to see a couple of them this evening, but also to now listen to this interesting little videos that they all do. So let's roll the first one, which is called The Happy Healthy Toe. We can all appreciate what a big toe should feel like. So let's listen to the first one.
Hi everybody, my name is Sophia Robledo, and this is my PSA video where I will be focusing on our big toe joint and the medical conditions that affect our big toes. Gout is a common form of inflammatory arthritis. Typical joints affected by gout include the big toe, the base of the thumb, the wrist, knees, or the ankles. Some symptoms with gout include severe pain, redness, there's also swelling in the joints, most typically the big toe. Pain attacks might occur unexpectedly and frequently during the nighttime. There's also some physical abnormalities surrounding the affected joints. Some warning signs to look out for include pain in the big toe. There can also be pain in the knees, ankles, wrists, and/or elbows where gout can flare up. And if the joint is feeling very hot and very tender, that's also another warning sign. A bunion is a bony bump that forms on the joint at the base of the big toe. It occurs when some of the bones in the front part of the foot move out of place. And some of the causes for bunions include tight shoes, foot stress, and arthritis. Some symptoms for bunions include a bulging bump on the outside of the base of the toe. There's also swelling, redness, or soreness around the big toe joint. Corns or calluses can also form with bunions. There's also an ongoing pain or pain that comes and goes. Some warning signs for bunions. It's important to look out for a bump or lump on the side of the big toe. The big toe can also be turned in or at an angle. It can even be overlapping the toe next to it. The purpose of this PSA video is to distinguish a bunion from gout in the big toe. The reason why gout may be mistaken for a bunion is that one of the most noticeable symptoms of gout is a red, painful swelling around the big toe joint. However, unlike bunions, which form over a long period of time and produce pain gradually, gout often generates sudden and sharp pains. It's critical to recognize the differences between gout and bunions. This would prevent misdiagnosis and allow for proper pain treatment. Thank you guys for listening, and remember to stay active and to wear the proper footwear to keep your toes happy. This would prevent misdiagnosis and allow for proper pain treatment. Thank you guys for listening, and remember to stay active and to wear the proper footwear to keep your toes happy.
So now when you take your shoes off tonight, you can look with an educated eye at your feet, and now you'll sleep much better tonight. Hopefully your feet will feel a little better and you'll understand it if they're bothering you. That was a nice presentation. Any comments about it they'd like to make? Anybody want to do any politicking here before we go on to the next, thing? Okay, let's do the next one, which is ACL injuries. I know there's one doctor in this group who's an old ACL doctor. Maybe he'll have some comments to make after we're done. Let's hear about ACL injuries.
I'm Leonard Van Dalen, one of the interns for the Jackson Orthopedic Foundation, and I'm here to talk to you today about ACL injuries and ACL tears. Now, you might be asking yourself, what is the ACL? Well, the ACL stands for the anterior cruciate ligament. Now, as you can see from this diagram, our knee consists of 4 ligaments: the ACL, PCL, MCL, and LCL. Our ACL is the forward inner one here, and it sustains most injuries. Behind it, we have our PCL, that is the posterior ligament. Then on the medial side of our knee, the inside, we have our MCL, and on the lateral, we have our LCL. Those are our 4 ligaments. All right. Now you might be asking yourself, why am I talking to you about ACLs? Well, ACL injuries are actually one of the leading injuries in sports. Now, the ACL is one of the 4 ligaments that actually suffers the most injuries, and that's because of the nature of where it is. It's in the forward inside of your knee. The ACL is important for explosive interactions, for, say, trying to jump, for trying to land, plant, cut, things of those nature. That's where ACL is important. Now, that's why we see ACL injuries a lot in sports like basketball and soccer, and even in football, because of the planting, the changing direction that is necessary for these sports. When one is to step and their knee is not fully aligned, their knee might give out, and there goes their ACL. All right, now when one believes that they have an ACL injury, what they do is they go to the doctor. And the first thing the doctor will do is ask them the history of the injury. For it to be an ACL injury, there has to be a certain time where an injury occurred. It's not something that happens over time. It is an instance where you plant incorrectly, as I said before, or you land incorrectly, your knee gives out and your ACL tears. After that, the doctor will also ask about swelling, things like that, to understand the full history of the injury. Next, the doctor will perform a test on the knee in order to test the ACL. This is called the Lockwood's test, which I will show you. Now, when conducting the Lockman test, you want to grab above the knee with your outside hand and below the knee with your inside hand. You then apply pressure as such, and this will let you test the ACL, the ligament, and see if it's intact. If you feel a pull back, you'll actually feel the ACL pulling back, and you'll know that the ACL is intact. If you don't feel that, that's how you get a positive test, and you would think ACL injury. Now, after conducting the test, in order to get a better understanding of what's actually going on inside the knee, you would go and get an MRI done. First, you would do the Lockman test to have the reasoning for requesting the MRI, but then you get the MRI done. And after the MRI, surgery. Now, ACL injuries have actually grown a lot in terms of the way that they conduct the surgery. In order to repair the ACL, there's a lot of different ways that they can go through. Before, the recovery used to be a year, but now it's closer to 9 months, even getting to 6 months if it's a lesser tear. But essentially, what they do to repair the ACL is either they'll make a fake graft ACL, and put that in, you get a new ligament that's not part of you. It's pretty cool. The second way that they can do it is they use a hamstring tendon. Take that tendon out, and they actually use that as your ACL. And there are other ways like this that they can use. Now, with ACL injuries, after surgery, you are not done. The key to coming back from an ACL injury to sports is rehab. Going with your PT every 2 or 3 times a week and doing exercises on your own in order to strengthen your quad muscle, to strengthen your hamstring, strengthen your hips, your glutes. Things like that actually compensate for your knee and help your knee. So when you're recovering from ACL injury, these things are very, very crucial in order to get back into action. All right, thank you very much. I hope you learned a little bit about ACL injuries, what exactly they are, what the ACL is, and how athletes can come back from ACL injuries and become back to tip-top shape. Thanks.
Well, I'm going to editorialize just a little bit. I think he should get a vote from at least some of you out there. He's a one-man crew. He's the actor. He's the cameraman. I think that was his own knee that he was examining, and I was trying to figure out how he did that. I think I'd like to see a replay on that, but that was a very impressive video. One guy could do all that. Okay, the next one we have is carpal tunnel syndrome. We have a hand surgeon in the crowd, and I'm going to definitely ask him to comment on.
A few moments later.
Hi, Dr. Sarah.
Hi, Andre. Thanks for contacting me today. I'm an orthopedic specialist, and you mentioned that you were feeling some pain in your wrists. Could you give me a bit more information about that?
Actually, yeah, I've been having some tingling and numbness in my fingers, and I tend to be dropping a lot of things lately. I suspect that I have carpal tunnel syndrome. Do you think that could be the case?
Yeah, that's definitely a possibility. Carpal tunnel syndrome is characterized by that tingling feeling and pain and weakness in your wrists and fingers. And it happens when repetitive motions lead to swelling in those tendons, and that puts pressure on the median nerve, so that causes the pain. Can you think of any repetitive motions you've been doing lately that might contribute to this?
Actually, yeah, I've been gaming a lot, and when I'm on my keyboard, I tend to have my wrist in an awkward position. Do you think you could recommend anything for me?
I think the first thing I would recommend is that you make an in-person appointment so I can confirm some things. But in the meantime, I'd recommend wearing a splint while you're sleeping so that you can kind of stabilize your wrist, and then also avoiding activities that aggravate your symptoms. Maybe try looking into like a better desk system so that your wrists aren't in those awkward positions, and also doing some exercises to keep your wrist mobile. If you can't avoid activities that aggravate your symptoms, I think the best course of action would just be to take regular breaks and just stretch your fingers, move your wrists around. But if the pain continues or gets worse, I think that I would recommend steroid shots or even eventually surgery, just so we can kind of manually like expand the carpal tunnel and relieve that pressure off the nerve. But I think I would recommend is first make an in-person appointment with me, and we can work from there.
Awesome. Thank you for that information. Can I schedule with you next week?
Yeah, of course.
Awesome. Nice talking to you, Dr. Sarah.
Thanks for coming in, Andre.
He's not in this room. Well, I guess. But I'd always walk by the exam room and hear music going on. Now I know what it's all about, I guess. The music. Is there somebody in here that was in this? There you are. Very nicely. Very well done. No, that was very interesting. No comments from anybody. Oh, there's got to be a comment from somebody. I'm sorry? Very understandable. There you are. No, it was interesting. Somebody else liked it too. Okay, we'll keep moving along. Remember, you got to keep track of who you're going to vote for, and there's no election tonight.
Hi, welcome to our presentation on osteoarthritis. A deeper look into bone breakthrough. My name is Trang Ha. My name is Neil Harper.
And my name is Neil Harper.
Okay, so what is osteoarthritis? It is a degenerative disease of synovial joints characterized by focal loss of articular hyaline cartilage with proliferation of new bone and remodeling of joint contour. Some clinical characteristics includes some deep aching pain. It can occur in one or two joints. Pain often occurs in the involved joints and is relieved by rest. There could be some stiffness in the mornings for about 30 minutes, and the aching night pain is also common.
So the most common potential causes that lead to arthritis include overuse of joints, age, obesity, which can cause unnecessary joint pressure, genetics, injuries, infections, and crystal formations within the joints. There are 7 different types of arthritis. There's degenerative, inflammatory, soft tissue, connective tissue, metabolic, infectious and septic, and musculoskeletal.
Okay, so some pain management. How can you reduce the pain?
So for arthritis that exists within the hands, there's ring splints, which help decrease pain, reduce swelling, and prevents deformations, and in general just helps contribute to a better daily functioning. And for the most common types of arthritis, you could also use physical therapy.
Okay, so some exercises you can do is some inner range quads over roll, as seen in this image. The next one is a single leg bridge. Some standing leg side raises, and seated knee extension with resistance.
Some of the ways to help reduce the risk of arthritis is exercising, number one. So a lot of the exercises that we just saw with the past slides, stretching, avoiding injuries, get routine preventative care, maintain a healthy diet, and make sure to stay at a healthy weight.
Yeah, and the more active you are, the better you'll feel. Exercise normally helps move fluid away from the joints, reducing inflammation and strengthening the muscles that help support your knee.
Hi, everyone. My name is Vivian, and I am a part of the Health Immersion Program at Jackson Orthopedic Foundation for the summer of 2022. Today, I would love to share what I've researched on osteoarthritis versus rheumatoid arthritis. And towards the end, I would love to also share why women tend to be more affected by arthritis than men are. So to get started, what is arthritis? Arthritis is known as joint inflammation, and it is one of the leading causes of disability in the US. Common symptoms include generally swelling, pain, stiffness, and a limited range of motion in the joints. Coming into this research, I did not know there were 100 different types of arthritis. So thank you so much, Kathy, for letting me know. But today we're just going to cover two of them, osteoarthritis and rheumatoid arthritis. So osteoarthritis is the most common type of arthritis. What happens here is we see a wearing of cartilage, the protective layer at the end of the bones. However, cartilage is not the only area that's affected. Osteoarthritis actually affects the entire joint, including the cartilage, the ligaments, and the tendons. And to the left, you'll see a comparison between a healthy joint versus a joint affected by osteoarthritis. Again, some of the symptoms are commonly known to be pain in the hands, the neck, the lower back, knees, and hips. Some treatment options include physical therapy, but for more severe cases of osteoarthritis, surgery is highly recommended. And as far as preventatives go, it's just really maintaining a healthy lifestyle, a healthy weight, staying active, and those are all great preventative measures. Compared to rheumatoid arthritis is the most common type of inflammatory arthritis. So there are other types of inflammatory arthritis as well. But what happens here is someone could have an overactive immune system attacking healthy tissues in the joints, around the spine, the hands, and feet. The causes of RA are different for everyone, but we also know that factors of the environment, such as viruses, levels of stress, and smoking, can also trigger those who are genetically predisposed. Having a healthy microbiome is really important to an immune system. So an unbalanced microbiome can also affect the immune system and make it a lot weaker. Symptoms here include joint pain oftentimes in more than one area. You'll see tenderness or swelling in the areas that are affected. And sometimes we'll also see weight loss, fever, and fatigue as the immune system is involved in this disease. It's really, really important to diagnose rheumatoid arthritis early on. It's very critical to slow the disease activity and prevent permanent joint damage. Medication can help, but as always, the best preventative measure is upkeeping a healthy lifestyle, regular exercise, and stress control. So why is arthritis more common in women? In my research, I found two reasons why arthritis can be more common in women. One of the reasons is having more lax joints, and this means the bones in women tend to move around more and are less stable within the joint, usually accommodating for childbirth. And so when we see less stability, we're more prone to injury, and this can eventually lead to arthritis. Another reason is estrogen. So the estrogen hormone keeps inflammation in check in women, and this is also a reason why younger women tend to have less arthritis than men. And when we see hormones and estrogen decreasing with time, with menopause, this can eventually lead to arthritis, more specifically rheumatoid arthritis. And that is all I have for today based on my research. Thank you everyone for a great 4 weeks. I have learned so much, and I look forward to seeing what the rest of you have to share.
Say a word. Just say thank you very much, and I enjoyed it. But why did you pick it?
Hello, thank you all. Also, want to give credit to Andre because of his amazing editing skills. We picked carpal tunnel syndrome because it's fairly common, and was really interesting to see that. I just wanted to know more about the topic. Yeah.
Good job. And remember, no one's a loser. We've got more Oscars up here, which we'll get out to the other participants. Any comments before we wind up this evening? Now evening. Thank you very much for coming. It's always kind of fun for me anyway, to see this, because I've kind of seen these students during the summer, and to see how things come together, and also the presentation we had from one of our alums. So thank you very much for coming, and keep the Jackson Orthopedic Foundation in your mind, and look for those announcements on Hawaii when the next program there opens up. And next year is our 25th anniversary, and when I do the math on that, I know that we have gone through 5 presidents. Bill Clinton was president when the Jackson Arthritis Foundation started. Anyway, thank you all again for coming. Get some food. Hit the silent auction again. If you're close, try it again. I'm going to go over there myself. We've got food left over here at the bar. There's no hurry to leave. And enjoy the rest of the evening. One more announcement Kathy has.
I want to reiterate what Pete said. Thank you so much for coming. But also, we like our winners in the silent auction to take their gifts home from here. So 2 things that are really important. We have a lot of boxed meals, and we really need you to take those home. So if you're going home, they're good. They're honestly good. This is from the bistro in Walnut Creek. It has another part to its name, but it's good food. If you're not going home or you don't eat that kind of food, take it to someone you know will eat it, because we really want you to enjoy the food. And that's what you were here for, right? The food. And finally, the silent auction winners, Reiko and Tom, are going to spend just a couple of minutes pulling up the page so we can tell you where you stand. But you know, if you did it on your phone, you know who you are. And we trust everybody. And you know, nurses are some of the most trusting people. So you could walk out of here with that whole table and it wouldn't offend us. But I think all of you came for a reason. The reason is the students, and we really appreciate all of your support. Thank you so much for being here.